Well, one of the things that you've been extremely successful is by getting residents involved. And you talked about information. How do you get the information out on these issues?
Internet is a wonderful way. Mailings, we do mailings, but primarily internet, your TV access, your show, PSAs. We use a number of mediums to get the information out. We use the nonprofit organizations. We'll be doing mailings, letting people know that these events are coming up. And we ask them to call into City Hall in terms of trying to get a number. We're not really asking for reservations, but we really need to know how many people are we expecting on the day of the event. So that's why we ask people to call in.
And Councilwoman, one of the things that's extremely important is that the residents understand these issues exist, but they also understand that this is not taxpayer money. This is either urban enterprise owned money or corporate sponsors.
Exactly. It's a lot of corporate sponsors, a lot of local sponsorship. Our UEZ funds sometimes kick in, but primarily I and other people advocate for the corporate dollars to help do these events.
Councilwoman, I want to thank you for your leadership on this issue and many others. And since this is being taped on Monday, I know you're going out and vote tomorrow.
Oh,
so
most definitely.
Absolutely. And it was good seeing your two sons on Halloween, by the way.
Oh, yeah. It was good trick-or-treating at your front door. They love it. They talk about it all. When are we going to Chris's?
Good.
When are we going to Chris's?
Well, thank you for joining us this evening, Councilwoman. If you'll stay with us after these messages, pleased to be joined in the second segment by Dr. Gloria McNeil, who is the Associate Dean at UMDNJ School of Nursing and directs the New Jersey Children's Health Project, which is called NJ CHIP. We heard an awful lot about this program during the debate in Congress earlier this year, and New Jersey takes full advantage of the Children's Health Program. Dr. McNeil, welcome to the show.
Thank you very much, Mayor. It's a pleasure to be here.
First of all, Doctor, I'd like you, if you don't mind, tell us a little about yourself before we get into this great work you're doing.
Well, I'm actually a nurse, and I'm a critical care nurse by history, and initially loved working in the intensive care unit, but as patients became more and more ill and transferred home in that state, I started moving into high technology home care. And so what that did is allowed me to see just how much community-based care is needed. And with that, I transitioned on to look at ways of delivering care in innovative approaches such as the Mobile Healthcare Project.
So is your PhD in nursing?
It is in higher education administration. So I started out as a staff nurse and moved on to more administrative positions and ultimately now as Associate Dean for Community and Clinical Affairs at UMDNJ.
Well, it's impressive educational requirements. I congratulate you for the hard work you put into that. The UMDNJ, have you been there most of your career, Dr. McNeil?
7 years. The past 7 years I've been there.
And tell us the New Jersey Children's Health Project and how you became involved in this project.
Right. One of the important missions of UMDNJ is community service. And the School of Nursing, consistent with that mission, also has several community service initiatives. This is one of those. So about 2.5 years, our dean decided that this would be an approach to bring very important primary care services to the community. So initially, we did not have a mobile unit. We traveled with nurses' bags and established our relationship with 5 partnerships, and we would go into those facilities and deliver care in a private space inside the facility. We then was linked through the University Foundation with the Children's Health Fund in New York, a New York City-based organization that has 24 programs throughout the country. And so we became the New Jersey Children's Health Project, the 22nd program at that time, and they donated the mobile unit that you see us traveling around in. And that is a signature logo on that vehicle. In all 24 states, you will see similar color, but it will have a different name associated with the city or the state in which it is located.
Now, Dr. McNeil, if I can, when you came to City Hall, you had some corporate partners on that.
Absolutely.
Is that necessary in all of the states in the nation? Are there corporate partners in different states?
There are, and foundation partners as well. And so typically these are the organizations that provide monies to support the projects. So we're very pleased to have the Healthcare Foundation of New Jersey, Shearing Plow, Santa Fe Adventist, and other of our funders who have assisted us.
The Children's Health Fund contributes to New Jersey's Children's Health Project. How exactly does that happen?
Right. The Children's Health Fund actually contributes to all 24 programs. And so what we do every year is provide a report of who we've seen, how many clients and so on, and they then generate monies to support everything that we do. So far, in addition to the vehicle, they've provided for us nearly $400,000, monies to buy supplies and to help with the salaries, particularly with our pediatrician.
Now, how many hours this bus pulls up to a neighborhood? Is this bus going to sit there for an hour, 2, 3, 10, 8? What?
We usually go to 2 sites a day. So we start out in the morning, 9:30. We leave there at noon. Go to our second site. We get there about 1, and we stay there until 3.
So you eat lunch on the bus?
We do. On the run, yes.
On the run. It's probably not real healthy, is it? So,
Well, we try fruit,
okay.
vegetables. We have to be role models.
yeah, that's right. You have healthy food, but eating on the run is,
Right.
you wouldn't tell the clients that.
Right.
Now, you can do a little bit of everything there. You can do blood pressure. I mean,
Oh,
you
yes.
can't do mammograms and you can't do any invasive equipment, but you can refer them, is the way you explained it
can
to me
refer.
when you were out front of City Hall. Tell us about that process.
Sure. There are 3 exam rooms aboard the vehicle. And so when the clients enter, they're usually scheduled by the site coordinator at the agency that we've affiliated with. And they're seen by advanced practice nurses. These are nurses who are licensed in the state of New Jersey to diagnose, to treat, to write prescriptions, and to refer clients to specialty areas as needed. So the nurses will evaluate the clients from a primary care perspective, and typically these are conditions like asthma and congestive heart failure and diabetes and high blood pressure, those kinds of diseases. And we will help the clients bring their bodies to optimal health.
And Dr. McNeil, Sharing Plow and their donation, did they put this project over the top? Were they one of the key players here?
They were absolutely one of the key players. And what this generous donation is going to do for us is allow us to bring on more staff, which is so important because we need to enlarge our services to many more cities and also expand our time.
What cities are you serving now, Dr. McNeil?
Currently it is Irvington, Newark, Elizabeth, and New Brunswick.
And in getting to those cities, you have designated spots. Like, where are the spots in Elizabeth you would be going to?
We do. Jefferson Park Ministries, the YMCA of Elizabeth, and the Leaguers Preschool in Elizabeth. Those are the 3 sites.
And those 3 buildings will be working with you for any ancillary issues you may have when you're on
That's
site.
correct. That's correct. There is an MOU, a Memorandum of Understanding, that is signed between the 2 entities, and it identifies our ability to have a site coordinator named, a person who will work with us to schedule the patients, and who will sit on our community advisory board.
Now, how many people actually work on the bus when the bus pulls up?
There are 3 advanced practice nurses. 1 day a week, we also have a pediatrician. But then we also have student nurses and medical students aboard the vehicle.
Now, when the pediatrician is there, how do the folks know that there'll be a pediatrician on that day? Are they told in advance in any way, or is it a potluck type of thing?
They're not. And the family nurse practitioners, that's a special certification that the advanced practice nurses have, enables them to manage pediatric cases as well as adults and seniors.
Now, you've used this advanced practice nurse. Is this higher than an RN, equal to, or higher than an RN?
It's higher than. Currently, a master's degree is the minimal credential, and it's moving now towards a doctorate in nursing practice as well.
To be categorized as an APRN, would that be
It's
it?
an APN, Advanced
APN.
Practice Nurse.
Okay.
Yes.
The services provided on the bus, we talked about a few. Any psychological counseling on the bus? Anything
Well,
else on the?
right.
Somebody brings in a kid, they're sick, and they need somebody to talk to. Does that happen on the bus, or is it strictly clinical?
No, the advanced practice nurses are able to diagnose anxiety, depression, schizophrenia, and manage those cases. Now, when it is really beyond the scope of practice, then we refer them out.
Do you encourage them to come back when the bus comes back for follow-ups, or you encourage them to see naturally a private physician they probably don't have the money for? They wouldn't be getting on the bus to begin with.
That's right. We would like to be your primary care provider if you do not have one. So we try to target individuals who are uninsured or underinsured and have limited ability to pay. Right now, because we are so well funded, we are able to offer our services free of charge.
So do you think in the future that may change?
It will, and with the debate that we're having with healthcare reform, we think that there may be some mechanisms by which the nurses will be able to bill directly an insurer for the services that we provide.